Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. What brings you in today?
For about a year, I've been experiencing constant fatigue, and recently I've noticed some shortness of breath, especially when walking or doing light exercises.
I see. Any other symptoms or medical conditions you're dealing with?
Well, I have this occasional chest discomfort, which feels like a tightening sensation and sometimes a mild pain, but it usually goes away after a little rest. Also, I've had type 2 diabetes for about 5 years now, for which I take metformin.
Do you smoke, or have you ever smoked?
I used to smoke about a pack a day, but quit 10 years ago.
That's good to know. What's your activity level like?
I used to be quite active, but in the last year or so, not much. Even a short walk makes me feel winded.
Do you experience dizziness or fainting spells?
No, not really. But I've noticed I feel increasingly tired as the day goes on.
Any family history of heart disease?
Yes, my father had a heart attack in his early 60s.
How old are you now?
I'm 55.
Have you undergone any surgeries or other significant medical treatments?
I had gallbladder removal surgery about 3 years ago.
What medications are you currently on?
Just metformin for diabetes, and occasionally Tylenol for headaches.
Are you allergic to any medications?
No, not that I'm aware of.
Your blood pressure is 155/95, pulse is at 90, your weight is 220 pounds, and temperature is normal at 98.6. I see that your ankles are a bit swollen as well. Given your symptoms, medical history, and particularly the diabetes and former smoking habit, I'm concerned about potential heart issues. I would recommend undergoing a cardiac stress test, an EKG, and some blood tests, including cholesterol and glucose levels, to assess your cardiovascular risk. Additionally, I'd like you to continue monitoring your blood sugar levels daily, and we should consider adjusting your diabetes medication if necessary.
Okay, that sounds thorough. What should I do about the immediate discomfort and fatigue?
In the meantime, avoid strenuous activities and make an appointment for those tests as soon as possible. Also, please take note of any additional symptoms and try to rest and elevate your feet to alleviate the swelling. We will have a more comprehensive treatment plan once we get the test results.
Understood, doctor. I'll get those tests done as soon as possible.
Excellent. We'll proceed once we have a clearer picture. Please contact the office to schedule a follow-up as soon as you have completed the tests.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mrs. Thompson. I see here that you've been experiencing chronic fatigue and frequent headaches for the last few months. Is that correct?
Yes, doctor. It's been really difficult. I'm tired all the time, and my head feels like it's going to split open most days.
I'm sorry you're going through this. Let's get to the bottom of it. When did you first notice these symptoms?
I'd say it's been about 4 or 5 months now. I thought I was just stressed, but it doesn't seem to be going away.
Have you noticed any other symptoms? Perhaps changes in your weight, sleep, or even your menstrual cycle?
No, I haven't noticed anything like that, although I think I've been sleeping a bit more than usual.
All right, and what about your medical history? Any chronic illnesses or medications you're currently taking?
Well, I'm 45 years old and I have a history of hypothyroidism. I take levothyroxine daily.
That could be relevant. Are you taking any other medications or supplements?
No, just the levothyroxine and a multivitamin.
I see. Well, given that you have hypothyroidism, it would be important to check your thyroid hormone levels to see if your current dosage is still effective. We should also check your hemoglobin levels, vitamin D, and iron status, as these could also contribute to fatigue and headaches.
So you're going to take some blood tests?
Yes, we'll need to do a comprehensive blood workup to get a clearer picture of what's going on.
Do you think this could be something serious?
Well, it's too early to tell, but it could be that your thyroid medication needs to be adjusted, or that there's another underlying issue we need to address. Once we get the blood test results back, we'll have a better idea.
And what about my headaches?
The headaches could be related to your fatigue, or they could be a separate issue altogether. Do you experience any other symptoms with your headaches, like nausea or light sensitivity?
No, not really, just a dull, constant ache.
We may consider doing some imaging studies, like an MRI, depending on the blood test results and your response to any treatment adjustments. I would also recommend a consult with a neurologist if the headaches persist.
That sounds like a lot, but if it helps to figure out what's wrong, then let's do it.
I completely understand, Mrs. Thompson. For now, let's start with the blood tests, and based on those results, we can plan our next steps.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hello, it's nice to see you again. We met a few weeks ago, remember? Dr. Patel and I have been going over your recent tests and x-rays. So you've been experiencing knee pain for about 6 months now?
Yes, doctor, that's correct.
Could you please describe the pain to both me and Dr. Patel? Is it a sharp pain, a dull ache, or something else?
It's mostly a dull ache, but sometimes it becomes a sharp pain when I try to bend my knee.
Do you experience any swelling or redness around the knee?
Not much redness, but yes, it swells up a bit, especially in the evening.
How do you think you'd feel if you had to go up and down stairs multiple times in a day?
Oh, stairs are a nightmare. I avoid them as much as I can, to be honest.
Thank you for sharing. This information will help us tailor your treatment plan effectively.
Now look at question 26.
First and foremost, make sure to wear a clean apron and gloves. If you have long hair, tie it back so it doesn't interfere. Inform the patient that you will be administering their insulin injection. Some patients may refer to it as their shot. Second, confirm if the patient is comfortable and ready for the injection. They might ask if it's going to hurt. Reassure them that it's generally a quick and mostly painless process. Third, perform hand hygiene. Wash your hands thoroughly and dry them using a paper towel. Then, prepare your equipment. You'll need an insulin syringe, the insulin vial, alcohol swabs, and a sharps container, all laid out on a sterile tray. Gently shake the insulin vial and then wipe its top with an alcohol swab. Use the syringe to draw the correct dosage. Make sure there are no air bubbles in the syringe. Finally, confirm the patient's identity and the insulin dosage with another staff member, if possible. Administer the insulin as you've been taught, usually in the subcutaneous tissue. Dispose of the syringe in the sharps container. Remove your gloves and wash your hands. Finally, observe the patient for any signs of adverse reactions and document the procedure in the patient's medical records.
Now look at question 27.
Hi, it's time for your eye exam. Are you ready?
Oh, sure, let's do it.
Can you walk to the ophthalmology department, or would you like some assistance?
Could I get a wheelchair? My legs are quite tired.
Absolutely. Let me help you into a wheelchair.
Great, thank you. Are you warm enough in here?
Actually, it's a little chilly.
Would you like me to get you a jacket from the cloakroom?
No, that's okay. But thank you for offering. May I please see your identity bracelet for confirmation?
Of course, here you go.
Your date of birth?
12th of April, 1965.
All right, thanks. Let's head to your eye exam.
Now look at question 28.
Hello, can you hear me?
Yes, I can.
I'm your recovery nurse. Your cesarean section went smoothly, and your baby is doing well.
That's a relief.
I'll be monitoring your vital signs and the bleeding every 20 minutes. You have a mask for oxygen. Is your breathing okay?
My breathing is fine, but my abdomen feels sore.
On a pain scale from 1 to 10, how would you rate your pain right now?
I'd say about a 6.
Okay, I'll let the doctor know. Do you feel nauseous or dizzy?
No nausea, but I do feel a bit cold.
Let me get you an extra blanket to keep you warm.
Now look at question 29.
Antibiotic resistance is a pressing global issue that poses a risk to both individual patient care and public health. Today, we're going to discuss the mechanisms by which bacteria become resistant to antibiotics and what interventions can be put in place to mitigate this. Let's start with the basics of how antibiotics work. They are substances used to kill or inhibit the growth of bacteria. But overuse or misuse can lead to resistance, rendering these drugs ineffective.
Now look at question 30.
How is Mrs. Rodriguez doing with her diabetes management?
She's doing all right, but her blood sugar levels are still fluctuating quite a bit.
Has she met with a dietitian yet?
Yes, she had a consultation last week to revise her meal plan.
Excellent. What's her current medication regimen?
She's on metformin and has been instructed to take it twice a day.
How is she handling her medication?
She seems to be tolerating it well. No reported side effects.
What about her exercise routine?
She has started walking 30 minutes every day as recommended.
That's a good start. Is she monitoring her blood sugar at home?
No, she hasn't started yet. She's not comfortable with the glucometer.
I'll make a referral to the diabetic educator. Maybe some training will help her become more confident.
That would be great. She could certainly use the extra guidance.
Let's keep her on the current medication and meal plan, and we'll reassess after she's met with the diabetic educator. I'll review her case again next week.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello, everyone. I'm Dr. Alex Harris, and I specialize in genomics and personalized medicine. Today, I'd like to talk to you about the rising field of personalized medicine, what it promises, and the hurdles we still need to overcome. First, what is personalized medicine? In a nutshell, it's a medical model where healthcare decisions, practices, interventions, and therapies are tailored to the individual patient based on their predicted response or risk of disease. It sounds revolutionary, and it could very well be, but it's not without its issues. For instance, collecting the type of data needed for personalized medicine is a massive undertaking. We're talking about DNA sequencing, lifestyle data, family medical history, and more. There are ethical questions around data privacy and consent, not to mention the technical challenges of storing and analyzing such vast amounts of sensitive information securely. We've seen some fantastic breakthroughs, such as targeted cancer therapies. These therapies, instead of attacking all rapidly dividing cells like traditional chemotherapy, only target the cancer cells based on specific mutations. This leads to more effective treatment with fewer side effects. However, even these treatments are not one-size-fits-all, or should I say, one gene fits all. For example, two patients with the same type of lung cancer and the same specific gene mutation might react differently to the same targeted therapy, and we're still trying to understand why. Then there's the issue of healthcare inequality. Right now, genomic data is predominantly from individuals of European descent. This means the algorithms and models we're building might not be as accurate or as effective for people from other ethnic backgrounds. The issue of representation extends not just to ethnic diversity, but also to age, gender, and socioeconomic status. Speaking of economics, let's discuss cost. Personalized treatments, by their nature, can't benefit from economies of scale in the same way as treatments meant for a large segment of the population. This can make them prohibitively expensive. How do we make sure everyone has access to these potentially life-saving treatments without breaking the healthcare system? On the flip side, personalized medicine could potentially reduce costs in other areas. For instance, knowing in advance which medication will work best could eliminate the often lengthy and costly trial and error process currently used for conditions like depression or high blood pressure. Not to mention, targeted therapies could lead to quicker recoveries and shorter hospital stays. Lastly, let's talk about the fascinating topic of microbiome and its role in personalized medicine. Our gut flora, the community of microorganisms living in our digestive tracts, plays a significant role in our health, affecting everything from our metabolism to our mental health. Could the future of personalized medicine also involve personalized diets based on our microbiome? In conclusion, personalized medicine holds immense promise, but is fraught with challenges, ethical, economic, and scientific. Yet, it's an exciting frontier that could revolutionize healthcare as we know it. While it might not be the silver bullet for all healthcare issues, it is a significant step towards more effective, less invasive, and potentially more equitable healthcare solutions. Thank you for your time, and I look forward to your questions.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name is Dr. Alex Field, a gastroenterologist and researcher. Today, I'd like to talk to you about the fascinating world inside your digestive system, more specifically, your gut microbiome. This microscopic community living inside you plays an essential role in your health, much like Dr. Werner's discussion on vitamin D. Firstly, what is the gut microbiome? Your gut is home to trillions of microorganisms, including at least 1,000 different species of known bacteria. These organisms do more than just help you digest food. They're involved in nutrient synthesis, immune function, metabolism, and even mental health. A balanced microbiome is crucial for overall well-being. A lot of people wonder if all bacteria are bad. The answer is an emphatic no. Your body is a complex ecosystem where different microorganisms coexist. In the gut, beneficial bacteria help break down food, synthesize certain vitamins, and protect against harmful pathogens. They're so important that a disruption in the gut microbiome has been linked to numerous health issues, from digestive disorders like irritable bowel syndrome, IBS, to mental health conditions like depression. One common myth is that probiotics are a one-size-fits-all solution to gut health. While probiotics can be beneficial, especially after a course of antibiotics, which can disrupt the microbiome, they're not a silver bullet. Each person's microbiome is unique, and what works for one may not work for another. Furthermore, the market is saturated with probiotic supplements making health claims that are not always backed by solid research. Just like Dr. Carter discussed the role of observational studies in vitamin D research, much of the excitement around the gut microbiome is based on similar types of studies. We've observed that people with specific health conditions often have different gut bacteria profiles, but it's not clear whether these differences are a cause or an effect of the disease. More controlled studies are needed to draw any definite conclusions. Diet plays a significant role in shaping your gut microbiome. Diets rich in fiber, fruits, vegetables, and fermented foods can promote the growth of beneficial bacteria. On the other hand, diets high in processed foods, sugar, and unhealthy fats can disrupt this fragile ecosystem. What's also compelling is the emerging research around the gut-brain axis, which suggests a complex interplay between your gut microbiome and mental health. For instance, some studies have found correlations between gut bacterial profiles and mood disorders. However, we must proceed cautiously, as much of the evidence is still inconclusive. Unlike sunscreen, which has demonstrated benefits in preventing skin cancer, the science of manipulating the gut microbiome is still in its infancy. While some early studies are promising, we're not at the point where we can make specific medical recommendations, similar to the limitations Dr. Werner pointed out regarding vitamin D and its purported wide-ranging benefits. So, what can you do to maintain a healthy gut? Diet is the best starting point. Incorporate more whole foods and consider adding naturally fermented products like yogurt, sauerkraut, and kefir. If you've recently taken antibiotics or are experiencing digestive issues, consult your healthcare provider about the possible benefits of probiotics tailored to your needs. However, if food sources aren't enough, you may need to add in a supplement. Remember, though, that most nutritionists believe food should always be your first choice, with supplements used as reinforcements. In summary, your gut microbiome is a critical, yet still somewhat mysterious part of your overall health. Much like the role of vitamin D and sun exposure, the balance is key. Just as you wouldn't overexpose yourself to the sun for vitamin D, you shouldn't self-prescribe probiotics or drastically alter your diet without professional guidance. Thank you for your attention, and take good care of your gut.